Hi, I'm Lily. Welcome to the Chronic Care Management presentation hosted by Chronic Care Advantage, the leader in care management services. This presentation will be divided into two sessions. In this session, we will discuss Medicare statistics, Medicare's chronic care management program including principal care management, and finally, patient and provider qualifications. In part 2 of the presentation, my colleague Raj will review the challenges of Medicare's chronic care management program, quality measures and care coordination solutions, billing and reimbursement, and partnering with the best care management service to expand your team to improve patient outcomes at no cost to you. In the 19th and early 20th centuries, healthcare reimbursement primarily operated on a fee-for-service model, where providers were paid based on the volume of services rendered. Overseers believed this system incentivized quantity over quality, often leading to fragmented and inefficient care. Recognizing the need for a shift towards better patient outcomes and cost-effectiveness, the healthcare industry transitioned to value-based care in the late 20th century. Under this model, reimbursement is tied to the quality of care provided, encouraging preventive measures, care coordination, and improved patient outcomes. The Centers for Medicare and Medicaid Services (CMS) has played a pivotal role in advancing value-based care, introducing programs such as chronic care management (CCM) and principal care management (PCM). These initiatives focus on managing chronic conditions and addressing the complex healthcare needs of patients, aligning with the broader goals of value-based care. CCM, for instance, encourages care coordination and proactive management of chronic illnesses, fostering better patient engagement and reducing overall healthcare costs. PCM extends this approach to a broader population, emphasizing comprehensive and coordinated care for patients with a single chronic condition. Both programs exemplify the evolution of reimbursement models toward a patient-centered, value-driven paradigm in modern healthcare. The statistics reveal the need for CMS's chronic care management services. In 2021, 70% of Medicare beneficiaries had at least one chronic condition, and there were 6.9 million Medicare beneficiaries. 93% of Medicare spending was associated with chronic health conditions, and beneficiaries with chronic conditions cost $11,000 more annually than those without chronic conditions. With the aging of our population, we can expect to see an upward shift in this data, leading to a greater burden on you, the practitioner, and the healthcare system as a whole. In 2015, CMS implemented the Chronic Care Management Program and began to provide reimbursement under the physician's fee schedule for care management services provided to patients with multiple chronic conditions with the goal to improve patient outcomes, enhance care coordination, and reduce healthcare costs by providing comprehensive and proactive management for chronic conditions. In 2020, CMS expanded reimbursement for its Chronic Care Management Program to include the Principal Care Management Program. Principal care management is designed to meet the needs of Medicare beneficiaries with one chronic condition. These Medicare care management programs were also designed to ease the provider's burden of caring for patients with chronic conditions by providing an opportunity to delegate some care management roles to skilled care coordination team members. Now let's talk about the patient qualifications for Medicare's care management programs. To qualify for CCM, the patient must be a Medicare beneficiary with 2 or more chronic conditions expected to last at least 12 months and have had a documented annual wellness visit in the last 12 months. To qualify for PCM, the patient must be a Medicare beneficiary with at least one chronic condition expected to last at least 3 months and have had a documented visit with a specialty provider in the last 12 months. It is important to note that in order to receive reimbursement for Medicare's care management services, the provider must be a physician or non-physician provider, including nurse practitioners, physician assistants, nurse midwives, or clinical nurse specialists. When partnering with Chronic Care Advantage, LLC, providers can improve patient outcomes through the provision of Medicare's care management services by skilled team members at no cost to the provider. In part 2 of this presentation, my colleague Raj will talk about the benefits of using Chronic Care Advantage to implement chronic care management, principal care management, and other Medicare care management programs. If you are interested in partnering with us, please reach out to us using the information provided on this page. We look forward to improving the health and well-being of your patients.